Will Medicare be there for you when you retire? Find out in A Boomer's Guide to Medicare. Then meet Deanie Parker, founder of Soulsville, USA, and get answers to basic questions about arthritis.
Hello, I'm Chris Hardaway. Welcome to the September edition of The Best Times, a series that looks at life after 50. Starting in January of next year, 10,000 baby boomers a day will reach age 65 and become eligible for Medicare. By the end of the decade, over 35 million boomers will be added to the Medicare rolls, with more to come. On tonight's It Matters segment, we look at Medicare. It matters because you've been paying into the program all your working life. But how much do you know about Medicare? And will it be there for you when you need it? Find out in A Boomer's Guide to Medicare. "45 years ago, on July 30th, 1965, President Lyndon Johnson signed the bill creating the Medicare program. The passage of the bill was the culmination of nearly 50 years of discussion and debate on national health insurance. In 1965, less than half of Americans over 65 had any form of health insurance. Today, 98% of seniors are covered by Medicare. Now that you know some of the history of Medicare, it's time for a quiz. Here's your first question.
How much money will Medicare pay out in benefits this year? Is it A, $289 billion, B, $504 billion, or C, more than $800 billion? The correct answer is B, $504 billion. Medicare represents 13% of the total federal budget. Try this one. Who received the first Medicare card? Was it A, Dr. Donald Berwick, B, actor and comedian George Burns, C, President Harry Truman, or D, a woman named Ida Mae Fuller? The answer is C. President Lyndon Johnson presented the first Medicare card to former President Harry Truman in recognition of his efforts to establish a national health insurance program. Here's our last question. Medicare is projected to remain financially solvent until what year? Is it A, 2017, B, 2029, C, 2044, or D, next year? The correct answer is B, 2029.
According to Medicare's trustees, the recently passed healthcare reform has extended the fiscal life of the program until then. More about that later. Now it's time to examine the ABCs and Ds of Medicare. There are 4 parts to the system, and we begin with Part A.
Medicare Part A handles the part of your medical needs that covers hospitalization. It's federally insured, it's a federal insurance plan for people over the age of 65 or those who are disabled.
So, Part A covers hospitalization. The deductible is $1,100 for each hospital stay. Extended hospital care is subject to coinsurance payments. But if you've paid Medicare taxes for at least 10 years, Part A is free. Part B gets a little trickier.
Part B, which covers your health provider, like your primary care physician, your specialist, your lab work, those sorts of things. That is your Part B, and it cost, for people who became eligible in 2010, it cost $110.50.
The Part B premium increases for incomes over $85,000. It allows you to choose any healthcare provider that accepts Medicare, but it only covers 80% of the bill. Many people buy supplemental policies to fill the 20% gap. Part B is optional. In 1997, Congress established Part C, which is even more complex.
It actually is an HMO, which takes Medicare A, your hospitalization, Medicare B, your primary care physician, that sort of thing, lab, and your prescription drug coverage and rolls it into a new plan that's underwritten by a private insurance company. You no longer would have original Medicare in its what we call its original form. Then you become what we call either under a pay for fee services, a PFFS, an HMO, or an HMO, a health maintenance organization.
The advantages of Part C may be lower premiums and/or expanded coverage and benefits. The downside is, as with any HMO-type program, you're limited to a specific list of healthcare providers. Plans vary by state. In Tennessee, you can choose from 42 Medicare Advantage plans. The final piece of the puzzle is Part D.
D equals drugs or prescription medications. And Medicare Part D came in 2005. And that was the first year. They started the enrollment in 2005 to start in 2006. And Medicare Part D allows people to select a drug plan that meets their needs for their medication.
Part D is optional and may be covered in a Part C plan. If not, you'll pay a monthly premium. There are 46 plans to choose from in Tennessee.
So, how much does it cost? In 2004, the National Health Expenditure Survey found that costs for premiums, supplemental policies, deductibles, and copays averaged almost $5,000 per year per person. That's over $400 a month. Bear in mind that the average Social Security check is just $1,071.20. The average Medicare recipient will pay over 30% of their income in out-of-pocket health care expenses.
This year, like always, we'll have our guaranteed benefits. And with the new health
You may recognize this public service announcement with Andy Griffith. He tells us about the impact of the Health Care Reform Act on Medicare.
protect us and Medicare from fraud. See what else is new. I think you're going to like it.
Most notably, the bill signed by the President will begin to close the infamous donut hole in Part D coverage. But it also starts the ball rolling toward future changes in Medicare that are inevitable. So the big question is, what is Medicare's future?
Medicare is extremely important to seniors.
We're talking about 47 million people who rely on Medicare as their lifeline.
It is an integral part of our healthcare system.
The problem is maintaining the funding of the program for a longer period of time.
Doing the math on Medicare reveals an equation that's out of balance. Currently, there are just under 4 workers paying Medicare taxes for every older American receiving benefits. By 2030, when the baby boomers have retired, that ratio will drop to 2.4 to 1, and healthcare costs continue to rise, averaging over 7% per year at a time when general inflation is at or near zero.
We're paying for it now on something that I will need in the future, and I don't know what that is. And that's a very difficult thing to balance.
Earlier this year, fiscal projections showed that Medicare would be in the red by 2017. With the passage of healthcare reform, the administration claims savings that will maintain solvency until 2029.
We have bought ourselves, so to speak, 12 additional years of solvency. And that's a good news, and primarily because of the gradual slowing down of the growth of Medicare spending.
Part of the issue is, I think, healthcare costs are probably not going to come down. The issue is bending the curve, have them go up less steeply than the original projection. To actually make healthcare costs go down is Herculean task that may not be doable. The goal right now is just to bend that curve somewhat downward.
The process of bending the curve consists of everything from cutting waste and fraud to reducing subsidies paid to private Medicare Advantage plans. The goal is to increase quality without cutting benefits.
But part of the Reform Act is at least to come up with demonstration projects for rearranging the way that care is paid for. And one of them is we're not going to pay for the hospital episodes separately from the outpatient care. We're going to lump them. And we will pay you a certain amount to both physicians and hospitals together for a full, let's say, 90 days of care. So it's now everybody's financial incentive to reduce cost while there are quality controls in there to be sure that quality of care doesn't fall.
So, the Health Care Reform Act takes some small steps toward ensuring the future of Medicare. But can the program survive without sweeping reforms?
It's how do you control costs while certainly not reducing quality and trying to improve it.
And to do that, we have to improve efficiency and deliver the necessary care and not waste care. In other words, only deliver the care to those who really need it.
Dr. Chang believes that removing inefficiency in the current healthcare system is the key to ensuring Medicare's future.
Case in point, that when you are shuffled between doctor's office to another doctor's office, or between a doctor's office and the physician and hospital, from time to time you need to make separate appointments, and then you wait, and medical records don't get transferred, and you waste a lot of time. So if we can improve the delivery model so that hospitals, or shall we say the whole system, runs like Federal Express, where trucks and airplanes work in tandem to deliver the package so that the package gets delivered by tomorrow noon. And so if we deliver healthcare the same way the Federal Express deliver packages, then I think that we can resolve a lot of the future problems in healthcare.
But healthcare is different than small packages. It's a lot more complicated to come up with the right system to treat people with heart attacks and do it effectively than it is to get a package from here to there. One of the big issues is uncertainty. We don't know in a given patient what services that person will need, and if we do everything just right, we still don't know how the patient will respond. We can do everything right, but the patient still may not get well.
In just over 2 months, the President's Deficit Reduction Commission will issue their report. At this point, no one knows the specifics of their recommendations on entitlement programs like Medicare. They could recommend raising payroll taxes, or cutting benefits, or increasing the eligibility age beyond 65. Next year, 10,000 baby boomers a day will join the Medicare rolls. Will it still be there for them and their children?
My own feeling is that Medicare will be there for my children. I think it's too important to program.
I think it's a political football right now, and we need to get it out of that arena and bring it to the table where it's what's good for our seniors.
I think it's not a matter of political will. It's a necessity. We have to.
The importance of Medicare, both for people and the political reality, are going to be such that we'll figure out how to do it, one way or another.
For more information, go to the Medicare website or call 1-800-MEDICARE. If you have questions about Medicare, you can contact the regional office of the State Health Insurance Assistance Program.